Hello, everyone, and welcome to New Front Frameworks presented by Connect. Connect is a San Diego nonprofit with 4 decades of experience in helping innovation entrepreneurs scale their businesses through our various programs, resources, and events. For more details, please visit our website, connect.org. A quick note, there will be a Q&A at the end, and our experts are available in the chat. Now, at this point, I am pleased to introduce Jeff Simpson, Senior VP at Newfront, and he brings nearly 20 years of experience in risk management. Welcome, Jeff.
Thank you, Val, and thank you to Connect for having us. Very pleased with our partnership and honored to be here today to help some organizations make their companies safer. Scott, if you don't mind putting up our deck page, we can get started here. Thank you. So just briefly, who is Newfront? We are a sponsor and a partner with Connect San Diego. Newfront is a full-service insurance brokerage. We do business across all 50 states and globally. Newfront has about 800 colleagues and places close to $3 billion in total premiums. What differentiates us is Newfront is a technology-forward brokerage. We've developed some proprietary technology that is client-facing, that is included with the relationship with us as your broker, that helps make your team lives easier when it comes to managing insurance. We facilitate brokerage relationships and this technology across commercial and business insurance for total rewards, retirement services, and personal insurance, private client. But today, what we're focusing on is risk and loss control and safety. So what I'd like to do is just speak a little bit about what you'll hear today. So Scott and I are going to do a Q&A session, a best practices session, and provide some tips for your organizations, your HR departments on how to keep yourselves and your employees safer. You may gain some tips here on strengthening your current safety practices. You may be starting from scratch and wondering how to implement one, or in some cases, you may have received visits from loss control representatives at your insurance company level or even at the OSHA level. Organizations find this session valuable also because sometimes you just don't know what you don't know, and you might pick up some tips here. So many employers have some of the elements in place that you'll hear about today and may not understand how to get the most out of them. So we will talk about that. One of the areas that Newfront focuses on is direct assistance with these programs to help drive change and provide better outcomes for employees as well as insurance carrier requirements. And in the end, when your risk control teams and your processes are working better for you, what we see with our clients are better outcomes, lower frequency of claims, lower severity of claims. And in the end, that just helps you save money in your insurance premiums and even your access to insurance, from an underwriting standpoint. So with that, I'm excited to get started. I'd like to introduce Scott Rhymes. Scott is the Director of Risk and Loss Control here at Newfront. And welcome, Scott.
Thank you very much, Jeff. I'm really excited to share what we do for our clients here today.
Wonderful. All right, well, we'll kick it off. So, Scott, what do you think is the single most significant thing that employers can do to drive change from a safety standpoint within their organizations?
Yeah, it's somewhat a pretty simple answer. And, we all talk about the safety programs and the priorities, and we're going to get into some of those conversations today. But the bottom line is that you need executive leadership commitment to make this work. If you don't have that, it's just not going to take root. Safety is not one of those things in an organization that can be done from the grassroots level. Sometimes you'll have an HR person deciding, hey, we're going to do safety, or there might be a facilities person, and those efforts will go only so far. What you really need is that leadership commitment. They have to bake safety into every level of the organization. I mean, look, leaders in organizations know how to get things done. That's why they're in business. They have a company, they're getting things done, right? They just have to shift their perspective to say, hey, safety is something that we need to bake into everything we do, into every standard operating procedure. And once they make that commitment and hold the organization accountable, these programs will start taking root.
Great. So commitment is essential across the organization, starting with leadership. So should employers worry about compliance, like compliance with OSHA? Workers' comp premiums are, and general liability premiums are already high in some cases. What should the priority be there?
Well, they're all important, of course, right? And I think there's this tendency, I work with a lot of clients across the board. I've been doing consulting now for a little over 20 years, and I've been in a lot of different employers over that time. And there's this real tendency for employers to really focus on the compliance piece. OSHA this, OSHA that. I need to have this written program, or maybe it just depending on what industry you're in, there's different levers that need to be pulled there from a compliance perspective. And so it's really tempting to focus on that. But I kind of see this as a three bucket problem, right? We have the OSHA compliance, we have, the premiums, which are pretty impactful on us, right? But that third bucket, it's, hey, can we make sure our employees don't get hurt at work? And for me personally, that's what I got into this business for. And I really believe that we should all be looking at that first. The cool thing about that, though, is if I'm going to focus on making sure that my employees are safe and they go home healthy every day at the end of the day, if I'm doing the right thing by them to make sure that that's happened, I'm also going to be taking care of those other two buckets. If I'm doing the right thing, compliance is going to happen on its own. And you know what? You're going to have less injuries. And that's going to contribute to a better insurance premium outcome. And also other insurance markets that might be interested in writing your business too.
So from a philosophical standpoint, doing what's right, taking care of your employees will ultimately make your company run better, end up saving you money, less issues with compliance. It's all symbiotic. I get that. So I think getting into the meat of this, what would you say an organization should do first? How do they get started when it comes to either implementation or assessment of current safety programs?
Cool. Yeah, this is going to be the long answer. There's quite a bit that needs to be done to get a good safety program up and running. But I think I'd like to provide a little bit of background from a compliance perspective here. I just kind of discounted it, but it is important and it does give us a framework with how to handle safety in an organization. So some of you may be aware of the Injury and Illness Prevention Program here in California. It's been around since 1991. But a lot of people don't know that California is the only state that actually has a full requirement for that IIPP to exist. At a federal level, they don't have an IIPP, but they do have something called the General Duty Clause, which generally says, hey, you as an employer, you need to provide a safe and healthy work environment for your employees. So if they don't have a standard that covers something specific, they give you a violation under what's called the General Duty Clause. Here in California, we have the IIPP. Again, back in 1991. There were some states before us that had an IIPP, and California used the information from those states and what they had accomplished to kind of craft their own IIPP standard. Now, those states have ceased to require it. Some of them still have versions of it. There's even some states in the US that will give discounts on insurance. California is not one of them if you put an IIPP in. So it's kind of like the carrot and the stick kind of thing. So, they looked at those other states and they put this thing into place. But since then, since 1991, there's been numerous studies that have looked at the IIPP standard and is it effective? And these have included both governmental studies and private studies, like Rand Corporation. OSHA's done some work on this internally. Institute for Work and Health, Center for Construction Research and Training. I found a study that they had done. The Workers' Comp Insurance Rating Bureau here in the state, they've done their own studies on this. State Fund has done studies on it. And they just come back to the same thing. The IIPP works. What's really cool about this, I talk to a lot of clients and I go out and they say, hey, it's the same question you just asked, Jeff. Like how do we get started? I don't really know where to go first. And that's what's really nice about the IIPP is that it has really distilled what we need to do as an organization to make safety successful. And I'm going to share my screen one more time here because I want to show you what some of those studies came up with early on. This is a really basic slide. So they found that the companies that are successful, the ones that have moved the needle on lowering injuries and making it a more safe environment, they have these 8 things in common. Management, leadership, and commitment. We already talked about that one. That is the number one and most important thing in this whole discussion is that first box. They have employee involvement. And employees, the line level employees, all the way up to senior leadership, are involved in the creation, the implementation, the monitoring, the ongoing workings of that safety program. They're there. It isn't just a top-down safety, mandate that goes down, thou shalt be safe, right? Like it's everybody's involved in this. That third box, the hazard identification piece and risk assessments, it's critical. And it's probably the hardest part of this whole thing is that the organizations that are managing safety, they know where the hazards are. They've looked at every single task that every employee does. They've evaluated what that hazard is. And they've developed that next box controls for how to deal with those hazards, right? They're managing all of their hazards in the workplace in a real-time environment, and they're really working hard at it. Kind of tied into that, they have comprehensive training. So they're looking at all the tasks, all the job duties, all the hazards. What training do we need to provide our employees from best practices standpoint, but also from a regulatory standpoint, and also from an insurance carrier standpoint? Their viewpoint on the insurance carrier is going to be much more tied to, where are the losses? They're looking at workers' compensation loss runs and they can see where the injuries are. And if you ever get visited by one of the folks from the insurance carriers, they're going to want to come out and really hyper focus on whatever that is. It could be slips and falls or material handling claims, repetitive motion injuries. That training needs to be dialed into those specific things, compliance things, right? That's all wrapped up into that training piece. The organizations that are successful clearly communicate with their employees. They have open door policies. They're talking about safety on a regular basis. They have anonymous channels for people to communicate and talk about how their safety program is going if they have concerns. That's a very active and dynamic communication system. They also have a really strong culture, and I kind of tie those two together. I know it's the last box there, but the culture really ties into really clear communications and just making sure employees understand that they can say something from a point of psychological safety, like they feel safe saying, hey, I don't like the way this is, or this tool is broken, or I have a problem with working with this particular chemical. I need more information. I need different personal protective equipment. They feel comfortable having those conversations. And then the last one there, I put compliance with regulations. Obviously, we still need to maintain compliance, but I do believe if we are doing the right thing by our employees, compliance is going to come naturally. So with that, this is what the studies came up with that are the key items. Cal OSHA took a look at this. They took a look at the other states and they said, hey, like how can we simplify this? How can we boil this down to like real easy bite-sized pieces? And that's where they came up with the IIPP standard. And these are the sections of Cal OSHA's IIPP. I tried to keep it really brief here, and I'm going to explain these as we go through them, but you're going to find they're very similar to what the studies have come up with. So responsibilities. We need leadership commitment, but we also need to have every level of that management chain knowing what they are supposed to do all the blocking and tackling of their safety program. What do I need to do as a manager? What does a senior manager need to be doing? And there's little action items involved with all aspects of the IIPP. So that's responsibilities. Compliance is 2 pieces. One, there's a compliance piece that talks about compliance with OSHA regulations. But the second part is compliance with your own safety programs. So you as an employer are using this IIPP, and you are going to make your own rules about how to handle things and how to be safe in your organization, be it chemicals or using a forklift, doesn't matter. Your employees need to follow those rules. So as an employer, how do you enforce those rules within your own organization? That's the big piece of this. How do you enforce that? Because if you have no rules around safety and people can just do whatever they want, well, you don't really have a program. So that has to be there.
And
Communication, yeah,
Scott, if I
Jeff,
might
yeah.
interject quickly, and I don't mean to skip ahead, but my understanding is that, if an organization goes and Googles, California IIPP and gets a huge, 100-page document and tries to implement that because they think more is more, sometimes more is less. Isn't it true that it's very important to whatever your IIPP actually says fits for your organization, and then on a day-to-day basis, you are actually practicing what your IIP says you should be doing?
You nailed it, Jeff. You're absolutely right. And in fact, when you go, I'm going to share some resources at the end of this. When you go look at an IIPP template right from CalOSHA, you can download it. We're going to give you the link at the end. It's about 10, 11 pages long. It is not a long document. You need to customize that for your own environment. But that IIPP is an umbrella document that says, hey, this is how we as an organization are going to manage safety. It isn't the entire safety program, though. And that's where the customization comes in. So let's say you're working with several, chemicals in your work environment and lab hoods. What is the danger there? What's the risks? What PPE do I need? Do my hoods work? So you'll have separate safety programs surrounding chemicals. You might have a separate safety program around the forklift operator in the warehouse. You might have a separate safety program for the ergonomics. The IIPP sits above all of that, and you kind of pick and choose what you need to kind of fit underneath that umbrella. But the important thing is, you mentioned the 100-page document. An IIPP should not be 100 pages long. It is an umbrella focused philosophical document about how you are handling safety in your organization. And the rest of the ones that are on this page, we already talked about on the other one, hazard correction, hazard assessment, we talked about that, training all of your people on all the hazards, all the compliance based and best practices based. And of course, the last one, they didn't put this on the other one, but record keeping. You have to keep track of all this stuff and write down what you do. That's going to protect you in multiple ways. One, it helps with the insurance carrier visits, but it also helps with the OSHA visits if you ever do happen to have one come. Hopefully you don't. But if that does happen, you have strict record keeping of everything that you did to protect your employees while on the job.
Wonderful. So the most important box on the prior screen, and you've mentioned it multiple times, is leadership and management commitment. So what should an organization's leadership team and managers do to enforce safety? What steps can they take where they're maybe not harping on it so much as building it into the culture?
Yeah, that's a great question. Let's go back to the compliance, square. That's why I left this up here. Like, how do we get people to do what we want them to do? If you go back to, kind of the old view of safety back in, let's say, 1950s, there was very focused on employees being the ones that were causing the problem, the at fault. The employee did something wrong. Hey, the employee didn't put their safety glasses on and they got splashed in the eyes with chemicals. So if we did an accident investigation on that, we'd come back and the action item would be, retrain the employee, discipline the employee, make sure they have safety glasses. And that is one way of looking at this compliance piece, this discipline and enforcement. But there's another way of looking at it, and there's a new way of looking at it that we're finding works much better when we look at the system. We look at the system of how things are set up. So if we were to do a good accident investigation on that particular example, we would be asking questions like, hey, were there safety glasses available? Do they fog up? Are they the right safety glasses for the task? Maybe the employee asked for them and they couldn't find them, and the manager was upset about that, and they said, hey, just get the work done. It's really quick. You have the lab hood will protect you, right? We don't know all those answers when we kind of stop short and just blame the employee for things. So we need to take a deeper look at how accidents occur and the manager's role in managing those risks, because it's huge. We need to spend a lot more time training our management team how to manage safety and where their responsibilities lie. So that accountability piece that from the senior leadership, and that's why we need senior leadership so involved, is they need to hold their management chain accountable for what they're supposed to be doing. So if we kind of dial all this back, we have this IAPP with 8 things that we need to accomplish as an organization. We can bake the action items from these 8 things right into how we do our normal business. It just is a part of what we do. And if we do that and hold our middle management accountable for making sure those things happen, the safety will be derived from that, right? And not just focusing on the employee themselves. I've been to a lot of organizations, and the IIPP again is something that's been required since 1991 in this state. And still, even this week, I went out to a place and I said, hey, let's start working on your safety program because we're having some workers' compensation issues. The claims are going up. And most of the people in the room, when I asked them, we had about 20 people in the room, hey, raise your hand. Have you ever heard of or seen your IIPP? And only like 2 people raised their hand. And I asked the 2 of them, have you read it? No, we haven't read it. So here we're sitting in a company with 20 middle and upper management folks, and none of them have read the IIPP, which is the cornerstone safety document that they should have in place. They legally should have it in place and have it implemented, but I also believe that it's the best laid out way to get a safety program going. So that it's important, but we have to hold our team accountable for making sure these things happen.
Great, thank you. So when we have a program in place and we're trying to assess how well it's working, and we probably have individuals on this call, Connect and Newfront work with life science companies, technology, government contracting, manufacturing, from a startup all the way to publicly traded. So really across the board, not specific to industry, are there metrics that an organization can use to monitor how they're doing? What are benchmarks that they can look at? Are we using insurance company loss runs or DART rates or OSHA data? Is there something is all of the above, or is there something simpler an organization can do to make sure that they're, living up to these criteria?
Right. Yes, it's somewhat an all of the above question, but I do tend to look at metrics in 2 different buckets. We have the lagging metric bucket. So lagging metrics are things that happened in the past. So you named a few. Loss runs, that's a lagging metric. Hey, that injury already happened. It's on this piece of paper. Like it's not foretelling the future. DART rates and OSHA logs, we'll talk a little bit more about that. That all happened in the past, right? So I can see these things in front of me and I can see what happened in the past. And I do agree that looking at our trends, our past trends, does somewhat tell the future, right? It can tell us what to expect in the future. But I do also believe that we can change that future. This isn't like a bad sci-fi movie with time travel, right? Like we can actually go back and say, hey, yes, I see what's happened in the past, but I'm going to change my ways and I'm going to move on, right? And those metrics are called leading metrics or proactive metrics. It can look either way, kind of works. And so I kind of want to talk about both of those and the benefits and negatives of each one of those. So if we go back and look at our loss runs are from the workers' compensation insurance carrier that you work with, right? And they are showing only the items that rose to the occasion of needing some sort of medical care, right? Someone went to the doctor for it to have ended up on that list. But I would challenge there's a lot of things that happen in an organization that never end up at the doctor, right? The small little cuts, a little something got in their eye, they washed it out, nobody went to the doctor, someone fell, they got up and walked away. There might be some strains and sprains or back pain that maybe clears up in a couple of days. These things don't show up on those loss runs. So if we truly want to characterize what's happening in an organization from a loss standpoint, we need to keep our own records on top of what is in those workers' compensation loss runs. Okay, so let's set that one aside and move over to the OSHA record keeping piece. There's a couple of things OSHA requires us to do for many organizations, and there's a huge exemption list that you can look up on Google for Cal OSHA, but have to keep track of their losses on something called an OSHA 300 log. And every year on February 1st, which obviously just happened, those employers also need to post a summary of those injuries up in like the lunchroom, essentially, where your label posters are. That needs to be published and pushed up, a summary of all your injuries for 2 months. That has to be posted. So those of you who don't have one of those up, you may want to consider taking a look at the requirements for making sure that's up. And even if you've had no injuries, that still has to be posted. And I've been probably on 100 different OSHA visits, over the years, and every single one of them asks for copies of the OSHA logs and the OSHA 300A summary form. That's that one I was just talking about. They'll ask for that at every single visit. They'll ask for about 3 to 5 years of those every time they walk in the door. So what's on that? It's very similar to the OSHA, to the workers' comp loss runs, in that only the serious injuries are on those. Only the ones that resulted in time away from work, like, hey, I got hurt so bad I couldn't come back to work. Um, or if you came back to work and you had some sort of restriction. So let's say you normally are able to lift 50 pounds, but the doctor comes and says, well, for the next 4 days, only lift 30 pounds, whatever it is. It's a restriction. So only the more serious injuries, again, medical care, are going to end up on that. Again, does this tell our future? Maybe a little bit. But I would challenge to say, hey, what is a better story to tell when we're looking at what our future is? And I think it's mostly related to what we are doing every day. Like, how are we managing safety in real time for our organization? So what might that look like? Well, one, do you have an IIPP actually implemented? We'll talk a little bit more about what implemented means. Do you have that in place? Are you holding safety meetings? What percentage of your employees are trained at any one given time? Of the accidents that you had in the year, how many accident investigations were completed? If there were action items from those investigations, how many of those action items were completed? You get the idea, is that if we can look at the positive things we are doing in our organization to drive safety in the right way, we can actually tell a different story. And the more of those metrics that you can keep track of and quantify, those really help you, especially when insurance loss control people show up to do their inspections. We want to tell the story like, hey, we know that we have all these losses on our loss runs, but we've had a moment of clarity here and we've figured out, hey, we need to make a change. We've put these new safety programs into place and this is what we're now doing. Jeff, that question back to you. If a loss control person comes out and sees a workplace that maybe has had a bad history, but now they're doing a lot better, right? And they're doing all these things, they're just going right down to the IAPP and blocking and tackling this stuff, and they have metrics. Are there things the insurance company can do to reduce premiums?
Absolutely. Absolutely. So that information then makes its way back to the underwriters who are working with us, the brokers, and we're negotiating better rates or adding in coverage, removing exclusions, things the insurance company were uncomfortable with in the past. They may not be anymore because there is a procedure and there is a safety program in place to help prevent those future claims that cost the insurance carrier money. So it's absolutely advantageous. And the other thing that we would do from a brokerage standpoint is create a narrative around these changes and show those to other carriers, at a renewal time to leverage better prices and better coverage within the program. So it comes back around on the insurance side 100%.
It's much easier to get insurance for folks when we have a client that's engaging on all of this and really involved. It makes Jeff's life a lot easier.
Sure does. Yeah. And
Not
everybody likes me better, my clients, because I produce better results when that's the case as well. Yeah, it's a more symbiotic relationship across carrier, client, and broker. That's great.
absolutely. And so, capturing some of those leading metrics can be a little bit of an administrative burden. And what I encourage people to do is like think about 2 or 3 of them perhaps that you can kind of track down. And if you're starting out on the whole IIPP process, it's actually pretty easy to pick a few. Um, so for example, on the training component, you say, hey, well, these are all the trainings that all of my employees are required to take. This is what Kailash says we have to do. Let's just start with that. Well, what percentage of our employees have all of that, right? Maybe it's 70%. Well, let's look again in 6 months. We should be, upwards of 90 to 100% if we're really putting these things into place. A super easy one is the accident investigations, like I mentioned before. You're going to have some accidents in your workplace. Let's do an investigation on it. Let's learn how to do that. These are things that us in the risk control department here at Newfront, we're working directly with our clients and kind of putting these things into place all the time and helping them create these systems to track and quantify and create those narratives for the insurance carriers. It's all kind of crafted into it. And I do want to mention one other one that I forgot to mention before. Another really good lagging metric is something called an experience modification factor. I'm not going to get into all the math of it, but it is a tool that the workers' compensation carriers use to help determine what the premium should be for a client, right? So it's based off of 3 years of your history, and the reason it's kind of an interesting metric is that it's such a large pool of information. Again, it's lagging, but it's a slow-moving metric. So the state, who uses the XMOD to kind of, they give us these things, the WCIRB, which I mentioned before. Because it's slow moving, if you just have a flavor of the month type safety program, you do something for a couple months and then you kind of give up on it, it's not going to move the needle with an experience modification factor, right? And the carriers know that. So if we start seeing the XMOD go down or up, we kind of have a better idea in terms of a long-term view of how that safety program is moving. So it's a nice one. It's a good one to use. I encourage everybody to look at the lagging and the leading metrics, use them together to kind of craft your story and look at what your trajectory is or is an organization.
Great stuff, Scott. I think that dovetails perfectly into my next question. So let's move on to action items. What can the participants, the listeners on the webinar today do right now? How do we get started right away? What are some steps that they can take? When they go back to their leadership, or if leadership is listening, what can we do here now?
Absolutely. So one of the things we're going to follow up with is a little one pager. I'll show you a little picture of it. Here we go. Let me share this for you. We're going to send out this one pager to everybody that has, you see the pink underline, those are all hyperlinks. And I wanted to try to give you all a really good starting place to say, hey, this is what we're going to do to get this thing going, right? Now, one of excuse me, one of the hyperlinks on there that is particularly useful, let me go back to it, is a link to a template. So this is an injury and illness prevention program. It's a Word document. It's on Kailash's website. You can download it for free. Super easy to use and fill in the blank. Even better than that, and I included the link for it on that sheet, is one that is from the California State Fund, and they actually have a wizard that does the IIPP for you. It asks a series of questions, you fill in it, and then it creates a Word document for you with an IIPP all completely done. It's a pretty nice way to just get started. Alternatively, you just download the Word document, fill it in yourself, and work through it. But those are two really good resources that are on that sheet. And then the one you see there with the blue bar at the top, that's actually a whole publication that Kailash has that if you want to read more about how to put all this into place, a lot more detail than we're talking about today, this book here, which you can see the latest was published in June 2024, that's linked to on the page. You can read through it. It gives you all the little pieces about what to expect from each of the sections of the IIPP. So, those are things that, right away you can start using internally. I will say, though, this takes time. It is easy to download this, fill it out, print it out, stick it in a binder, and put it in a shelf, right? That figurative shelf out there that nobody cares about. If we have a written document that's sitting on a shelf and we're not doing anything with it, it's not getting anywhere, right? Or people haven't even read it or know that it even exists. That's a problem. If we truly want to move the needle, and we already have our executive leadership commitment and their ability to hold the team accountable for making this happen, then we can actually start getting something done. So I'm just finishing up with a client It's been about 6 months we've been working on this. And you go, wow, 6 months, that's a long time, right? Like, no, I want to get this done right away. I get it. But to do it right, it's going to take some time. If you look at the regulation for the IIPP on CalOSHA's website, and I did provide a link for it on that PDF that you'll get, the IIPP is actually about half a page long. It is a really short standard. But what it's asking you to do is pretty heavy. So, for example, yeah, I talked about hazard evaluation, right? How much time is it going to take you, depending on the complexity of your organization, to catalog all the job tasks that all of your employees do, evaluate the hazards of those job tasks, and develop controls, training, PPE, engineering controls, equipment, whatever, for all of those? It takes time. And it sounds hard, but it actually isn't that difficult. So this company that I just finished working with, well, we're still working with it, but we're kind of coming to the end of this process of getting the IIPP all onboarded. We had a written IPP the first week. That was the easy part. What we then did is we worked with the executive leadership to create a steering team, and we took all the This is they have two locations. This company I was working with, so we took kind of parallel paths with the two locations, and we got all the managers and all the senior leadership in the room, and we met once a month for 1 hour, every month for 6 months. And over that period of time, we worked through individually and sequentially each section of the IIPP. So that hazard identification one that I talked about, we met for a couple months, maybe 2, 3 months just on that, and we gave homework, and they had to come back out. They did these evaluations. I went out there. I went out and helped them learn how to do those things. We workshopped it. They would bring things back to the next meeting. We'd work on them. They'd do more. So it was a kind of an iterative process. But we did that with each of the sections of the IIPP. At the end, we had a group of managers at both locations that knew exactly what was in the IIPP, had been trained on each one of the sections, had done a lot of the work that went into putting them together, and we had went through the process of actually creating action plans and blocking and tackling lists for each manager on how to keep this thing going on into the future. So you'll say, well, gosh, I don't want to wait 6 months for results. I will tell you that the first month, after the first meeting, that we kind of laid all this out and had the major conversations, looked at their loss runs, got leadership commitment, we started seeing shifts in the injuries that were happening at the locations. They were going down month one. And throughout the whole 6 months, our loss rate was dropping, and it still is. So I'm still involved with them. I don't go to every monthly meeting now. I'm going once a quarter, and and consulting with them on the phone. But that first 6 months, there was a heavy push to try to get this in and get that management team trained. Oddly enough, that same client had an OSHA visit. Was that a couple weeks ago? It was right before Christmas, or no, right after Christmas. OSHA showed up, and it was so awesome to see the managers being able to answer the questions from the OSHA inspector really fluidly. And you got to think about, like, hey, if we haven't socialized an IPP or a safety program with your group and OSHA's there, it's going to be really hard to answer those questions. So that's the biggest thing. Like, get a team, get leadership on board, download these documents and have the conversations. Have that steering team start working on it. This is not something you need an expert like me to do. I certainly help make the process easier and go smoother because I've been through it a million times, but you can do this on your own, especially if you read through that the publication that CalOSHA put out, had that document, you run through it. Look, like I said at the beginning, your management team knows how to get things done. There's no doubt about that. You have a business, things are working. It's just a commitment level to say, hey, we want to get this done also. So let's just put it in along with all of our other KPIs and metrics. Let's treat it like a normal business function of the company.
Excellent, Scott. Thank you. We have a few questions to get to, and I'll
Great.
definitely save time for that. Just some closing thoughts, though, if you don't mind, after listening to you go through those answers. I've been working with life science and technology and manufacturing companies from a brokerage standpoint for 18 years now. And I'll just reiterate that I have seen this process work time and time again for my clients and the clients of our brokerage firm. It's a long-term strategy. It takes a commitment across the organization, culturally, at the leadership level, as you've mentioned numerous times, and it doesn't change. It doesn't change the company the very next day, but it will a few days and a few weeks and a few months out. And to tie it back around to insurance and risk management, in the long run, when you do what's right for your organization and your employees, you ultimately have a safer company, a company that is viewed as less risky, a company that has less losses on your loss history, and you will save significant insurance premiums down the road. I've seen it go the other way where, a lack of safety and claims and costs will shut a company down if it's not paid attention to. And then the reverse of that is really aggressive premiums and access to coverage and policies that other companies just don't get because they don't have the track record that your organization has. Risk management is a combination of control and finance. The more you control, the less you have to finance. The less that you're going to have to pay to transfer off your balance sheet onto an insurance companies because you have good safety measures. So I would deplore everyone listening, to utilize us as a resource, to work with leadership and start to implement some of these things because it absolutely works. And it's beautiful to see when it does. So Scott, again, thank you for that. We did have a couple questions here. I can go ahead and read those and the two of us can address them.
Okay.
The first is, how can a startup balance cost constraints with implementing effective safety measures and risk management practices? We opened it with that question, right?
We kind of, yeah.
Yeah.
We did. Absolutely. And I would argue that putting safety, oh, did it go away? There it goes. Putting safety into play and having a program will actually save you money in the long run, lowering losses, lowering your insurance premiums. So like it's a win-win across the board. We often find too that when we look heavily at what our safety programs are, and we put changes into place, it makes our process is more efficient as well. We come up with solutions to make the work easier. So employees are able to do more work per hour theoretically, because they're doing it in a safer way.
And Scott, I know you and your team for our clients can also come up with ways that don't necessarily drive a lot of cost for an organization,
No.
whether it's just a monthly or quarterly meeting for the employees to go over what they should and shouldn't be doing, looking out for each other, right? Best practices. That's really, it might be 45 minutes of their time, but other than that, there's not a tremendous cost to it.
I'd say in the beginning, there's definitely a time commitment. That's going to be your biggest expenditure is just time, that we need the right people in the room to have these conversations and to drive the change. Yes, there is money that needs to be spent sometimes. Let's say you have a lab and you don't have any fume hoods and you have people working with chemicals and we need to put fume hoods in. I'm just a simple example, but those cost money, right? We need to put the right protections into place, and sometimes they do have a price tag. But in putting a safety program together, it's a time commitment for the most part. All the documents, everything that you need, you can get online for free. Like if this stuff doesn't cost anything, you don't need to hire private consultants. The only caveat to that is, I keep on bringing the chemicals up, but is, the exposure monitoring, that type of thing. You might need an industrial hygienist. For example, I'm a certified industrial hygienist, and I often do that for our clients to say, hey, what is the exposure to this methyl ethyl bad stuff? What can you be exposed to? How can we control that with engineering controls? Maybe we're going to have to buy a fan to put on that. But that's another place that Newfront really helps their clients, is to kind of help. Okay, let's do this in the most economical way as possible, and then we can help kind of fill in some of those gaps on the exposure monitoring.
Wonderful. I see here that Teresa had a very specific question around noise levels and hearing damage, but I also see Teresa had to go. I believe she left the webinar. So we can address that question and get it emailed out directly to her as she requested. So I'll go back up to what role does insurance play in risk management for startups? And what types of coverage should early stage companies prioritize? Yeah, and I can
That's you.
start. I'm happy to start with this one. Yeah, so risk management, I would say, is necessary at all levels. And as you're building a startup, it should be part of your culture and something that you're thinking about. Not necessarily something that you can afford to or would want to hire for, but everyone there should have a level of responsibility in managing risk within the organization. And I will say, let us be a resource as well. Reach out to us, and we can help answer questions for you and be a resource for you on things you can do to keep the organization healthy and safe. So with our clients, they have access to Scott and his team, and we don't charge additional fees for that. It might be as simple as, answering a question or two, providing white papers or best practices. We provide our clients with free access to a service called Xywave, and our interactive portal that our clients have access to, that the brokerage built, has some fantastic resources for safety. And we just think it's so important, as we've talked about ad nauseum here today,
Yeah.
that those are fees that are included here, and it should be part of your culture.
You have another question in the chat. Um,
I think the fourth one was just Teresa letting us know that she had to leave.
okay.
Jeff, we have another question that came through the chat.
Oh, in the chat, excuse me.
Yes. I'm with a startup that has the smart ID badge that performs monitoring and programmable safety apps. How could such a device help lower premiums? It can monitor heat, noise, radiation falls, and has a panic button.
So,
Fantastic.
yeah, I'll start, and then Jeff, I'm going to pass this one over to you too. So some of those things may be able to help prevent injuries. And of course, that's the obvious way for us to lower premiums, to have less injuries. So if we're monitoring those things, anytime we have real-time monitoring, as an industrial hygienist, I can say, like, I'd love to have that. It's a great opportunities because we can actually deal with hazardous situations in real time. Great. But I think maybe what you're getting at too is, hey, if we put something into place, is there some sort of credit back on insurance? And that's where I'm going to lob this back over to Jeff, because it doesn't always work that way.
It doesn't, no, not a direct credit. Well, in some instances, there might be a credit to a policy, and that could be a workers' comp policy or, a general liability policy where now you're more concerned about third parties that might be coming onto one of your locations. But I'm not discounting, kind of what the question was or the effectiveness of a device like that, because what we do at Newfront is any advantage that we can use to put our clients in a better position with the underwriters and therefore produce better results from a coverage and price and value standpoint in their insurance programs, we're going to do that. So we would take a description of this device and we would build it into a narrative, and that would become part of our submission that we would turn into all the carriers when your renewal period is coming up. So underwriters that, and the ones we try to work with ones that aren't just so black and white, they think outside the box a little bit and use some critical thinking, can see that there is something unique to this organization that will help keep their employees safe that not all their peers are doing. So that is absolutely something that you should bring to your broker's attention and have it utilized within a narrative to underwriting. Were there any other, sorry, I didn't have the chat up. Val, was that the last question in the chat?
Yes, that's correct.
Okay.
Well, wonderful. Then I would say, just quickly to close, we can give you a few minutes of your day back here, but we really, really appreciate everyone joining us today. I hope that it was helpful and you'll take some of this information back to your organizations and, take control of your safety. All of our contact information will be provided to you, as well as that one pager. That's a really nice resource document. And you know, we're a resource to the community, you know, through Framework. So anything you need, let us know. And we're happy to help out. Thank you.
All right. Well, thank you for joining us today, and thank you to our incredible partner, Newfront, and to Jeff and Scott for bringing us invaluable information. For those who may have missed parts of the webinar or would like to revisit the content, we are pleased to announce that this session has been recorded and will be shared later. Once again, thank you so much, and we're looking forward to connecting with you again soon. Bye.
Thank you, Val.
Thank you.
Bye.